Hi, I'm Jenny. I'm going to be your nurse today. Can you just state your name and date of birth?
Olivia Zach, 0908-2004.
Okay, do you have some time to talk about your type 2 diabetes diagnosis?
Sure.
Let's start off by telling me what you understand about your diagnosis.
So honestly, it's all very complicated and new to me.
Okay, it sounds like this diagnosis is very overwhelming for you.
Yeah, it is. I know the doctor is putting me on a medication called insulin, but I don't really understand how to take it. And I guess I have this disease because I'm overweight.
Yes, that is all correct. Your body has developed something called insulin resistance. Your pancreas isn't producing enough insulin, which breaks down glucose. This is due to your weight, genetics, and diet.
Glucose? What's that?
I'm glad you brought that up and that you're interested in your diagnosis. Glucose is sugar found in the food you consume.
Oh, I see. And I'm having a hard time breaking that down in my body?
Correct. That is why your doctor has prescribed insulin shots.
Is there anything else I can do to help with diabetes besides taking insulin?
Yes, incorporating exercise and improving your diet into your routine could help improve your diabetes. Tell me what a typical day of meals looks like for you.
Well, I usually start my day with a Frappuccino and a donut from Dunkin'. Then for lunch, I bring with me a ham and cheese croissant from Stu Leonard's with a soda. My freezer is full of those ham and cheese croissants. I did pair that with some apple slices. And for lunch, I usually don't have time to cook, so I go to Wendy's or McDonald's for a burger with fries.
It sounds like you have a busy schedule and may not have time to prepare meals for yourself. Let's look at some ways we can improve your diet. If you have time during the weekend, for example, you can look to prepare meals for the week. Some recipes could include chicken and rice and a salad. I'm glad you try to incorporate fruits like apples into your diet. You could definitely continue doing that and possibly throw in some vegetables and snacks as well, like carrots and celery. If you cut fast food for dinner down to about twice a week, that would be recommended. If you do go, try to swap out those burgers for a salad. Also, let's try to cut out sugary drinks. In the morning, opt for just regular coffee. For lunch, I recommend you try healthy sodas like Poppy and Olipop.
Okay, that's a lot. I never knew how much my diet could affect my health and cause such diseases.
I know it's a lot of information, but I want to make sure my wording is clear. So tell me, how can you improve your diet?
Well, for breakfast, I should stop having Frappuccinos, maybe get an iced latte instead. I also should probably stop having donuts, maybe opting for a week of prep.
Yes, that's perfect.
And for lunch, I do have some extra time Sunday nights, so I can prepare some meals then. I know Stu Leonard's has good deals for rotisserie chicken, so I can try prepping lunch. I was thinking of some chicken with rice, and I do like edamame beans, so I can have those as a snack.
Awesome. See, you're already getting the hang of it.
I'm nervous that I won't be able to get the hang of these things.
I understand this may be a lot right now, but with the help of our clinic and resources, I believe you'll be capable of handling this.
Thanks, that really makes me feel better.
Of course, that's what we're here for. Now let's talk about exercise habits.
Well, to be honest, I have a hard time incorporating it. I do sometimes go on walks on the weekends as I enjoy listening to my audiobooks then.
That's a great habit to have. It'll be great if you could try to incorporate a walk each day, allowing you to listen to every chapter. Even taking the stairs at work or parking your car a little farther from the building are steps to take to improve your health.
I can try to do that. Thank you for all the helpful information. Now can we talk about my insulin and how I take that?
Of course, I appreciate that you are willing to talk about this. For this medication, you'll be taking it once a day in the evening. It is a tablet, so you should take it with your dinner and swallow it with water to prevent side effects. You should also monitor your blood glucose, taking it every morning.
Okay, that's not too complicated.
I just want to make sure you understand how to take your medication. Can you explain to me how you'll administer and track your blood sugar?
Okay, so the insulin I will take each night with dinner, and I will let it dissolve in my mouth.
You're correct to take it with dinner, however, it's a tablet that needs to be swallowed, not dissolved. Therefore, you will swallow it down with water.
Okay, I see. I'll make sure to do that right before eating. And for my blood sugar, I will take that every morning.
It sounds like you're ready to make this work. Now tell me other ways you can manage your diabetes.
Well, we talked about improving my diet by incorporating more snacks and veggies as healthy alternatives to my current meals and drinks. We also talked about exercise, and I plan on incorporating that into my daily routine.
Great. It's clear that you're willing to modify your lifestyle to improve your health. Now, on a scale of 1 to 10, how confident are you that you can implement these changes?
I'd say a 7. It is going to be a lot, but I'm willing and ready to change.
Great. Let's meet again in 2 weeks and see how it's going.
2 weeks later.
Hi Olivia, it's good to see you again. How's it going?
It could be better, but I think I'm starting to get a handle on things.
I think what you're going through is really difficult, but I'm excited to hear how it's going and how the progress is going. The fact that you're here today thinking about this is a huge step in itself. Have you been taking your medications every night?
If I'm being honest, I have missed a few nights. I did have to pick up a few night shifts the past few weeks to pay for rent, but I have been taking my blood sugar every morning and I've seen the number go down.
That's okay. Even with this newfound challenge, your efforts are something to be proud of. A way to ensure to take your medications every night is by setting an alarm on your phone and carrying a pill organizer with your tablet for each day. That way you can take it to work.
I never thought of that. Thanks, I'll definitely try that.
Great. Now tell me, how have you changed your diet?
I have been meal prepping my lunch, but dinner is tough as I do give in to my cravings and sometimes get the Frappuccino in the morning. But overall, I've been able to improve my diet.
Awesome. I'm glad to hear that. If you're not ready to give up the Frappuccinos, we can try to cut it down to 1 to 2 times a week instead. How about your exercise habits?
With those extra night shifts, I haven't been able to exercise every day, only about 3 times a week. I have been taking the stairs though.
Your commitment is really showing. You're making a lot of great progress.
Thank you. I think with time I'll be able to really commit.
Now let's talk about some complications of diabetes and why it's important to comply with your meds. They include increased thirst, frequent need to urinate, feeling very tired, tingling and numbness in the hands and feet, as well as decreased feeling and possibly some blurry vision.
Those are some scary side effects, and I can avoid these by taking my meds.
Correct. Med compliance will ensure that these things do not happen. Another important thing to pay attention to is your skin, particularly on your feet and toes. Something called ulcers can happen on your toes. This is skin breakdown. Because of your decreased sensation, you may not be able to feel it.
Okay, what should I do to avoid this?
One way to make sure your skin stays healthy is to examine your feet with a mirror daily, making sure there are no sores or cuts on your feet or toes. Another thing to do is to utilize moisturizer, so it's important that you use lotion to prevent your skin from being dry.
Okay, I'll make sure to incorporate that into my daily routine.
Alright, now let's set some goals for your next visit. We'll focus on your med compliance, so let's try to have you take your meds every day, and let's try to keep improving your diet and exercise habits. We'll also incorporate some skincare each day.
I'll try my best. Thank you.
Let's review what we discussed in today's visit. What is a way you can keep up with your medications?
I can get a pill organizer from Dollar Tree to keep track of my meds every day. I will also set a daily alarm.
That's awesome. What about your diet and exercise?
I will keep trying to exercise each day. I have less night shifts next month, so I should have time. I will also try to eat out less and meal prep more.
That's really great. Lastly, can you tell me what we discussed when it comes to skincare?
I'm going to go out and buy some lotion to keep my skin moisturized, and I will use a handheld mirror each night to assess my feet and toes.
That's great. Last time we met, you said you were a 7 out of 10 when it came to your confidence in being able to implement these changes. On a scale of 1 to 10, how do you feel now?
I'd say a 9. I feel confident in myself thanks to all your help.
You've really made some exceptional progress since our first visit. I can see your commitment to tackling this diagnosis. I look forward to seeing your continued progress. We'll meet again in about a month or so to reassess.
Great.